Welcome to this educational recording on the topic of applying Plan, Do, Study, Act cycles, or PDSA cycles, to improve assessment of orthostatic blood pressure. The Catch-Rural Falls program is supported by the Nebraska Department of Health and Human Services, Office of Rural Health, through the Medicare Rural Hospital Flexibility Program. The content of this presentation is solely the responsibility of the presenters and does not necessarily represent the views of our funding source. The Catch-Rural Falls program is led by myself, Vicki Kennel, and my colleague, Dawn Venema. We are both faculty in the College of Allied Health Professions at the University of Nebraska Medical Center. I am an industrial organizational psychologist with expertise in quality improvement and organizational science. Dawn is a physical therapist and brings the clinical perspective of fall risk reduction to our team. The educational objectives for this educational reporting are to describe the intended purpose of Plan, Do, Study, Act, or PDSA cycles, to describe each element of a PDSA cycle, and to apply the PDSA approach to help you improve the assessment of orthostatic blood pressure in your clinic. We discussed the three fundamental questions within the model for improvement in a previous presentation. Once you have identified specific testable change ideas, the next thing to do is to test these changes. In this presentation, we will focus on the Plan, Do, Study, Act cycle as a method to study and learn how the change works in your own local clinic environment. The Plan, Do, Study, Act cycle is a cycle for learning and improvement that can and should be repeated multiple times. This cycle promotes a trial and learning approach to improvement efforts. By planning for, trialing out, studying results, and taking action on what you learned to develop knowledge over time about how a change might eventually result in improvement. The P stands for plan. So planning includes planning the test of change and a plan for collecting the data. We specify the question or the questions that we want to try to answer in this PDSA cycle, propose our predictions or our hypothesis about what we think will happen, develop a clear plan to test the change, and identify the data that we need to collect. The D stands for Do, which is where we run the test on a small scale. We carry out the test, we document what's going well, we document problems and unexpected observations, and we start to collect and begin to do some initial analysis of the data that we collect. Study is, or the S is study, which is where we really formally analyze the results from our test of change, and then we compare our results to our question and our predictions of what we thought would happen. So we complete the analysis of all the data we collected, we compare our data to our hypothesis, and then we summarize and start to reflect upon what we learned in this particular test cycle. And the A stands for ACT, where based on what we learned from this test, we make a plan for our next step in preparation for the next PDSA cycle. So we might choose to adapt or make modifications to our changes or approach, etc., and then run another test. We might decide to adopt, so we decide to test this specific change on a larger scale, or we might decide to abandon, so we don't do another test on this change idea. And we also begin to start to make plans for the next PDSA cycle. So what we'll do in this presentation is we'll walk through each step of the PDSA approach using an example of one cycle that could be used in efforts to improve assessment of orthostatic blood pressure. First, we'll start with the plan. So what does the planning phase entail? So the P of the PDSA cycle, again, stands for plan. It could just as easily stand for predict. So the key to a successful use of the PDSA approach is to ensure that each test cycle includes a clearly stated prediction, followed by a plan for a test of change to answer the question or the questions that we're posing in the planning phase. So we have an example here on the slide for you of what a plan could look like for a first test of change in a clinic that's working to improve assessment of orthostatic blood pressure for their patients. So the question that this clinic could answer, or one of these questions that the clinic wanted to answer, is to what extent will our clinic increase our rate of assessment of orthostatic blood pressure for adult patients ages 65 and older who screened positive for fall risk? What will staff report as facilitators and barriers to completing this assessment? So the predictions that were made in this example is that the rate of assessment of orthostatic blood pressure would increase from 0, because the clinic is currently not doing this practice, to over 50% in the next 2 weeks. They also predicted that staff will identify successes and barriers to assessing orthostatic blood pressure that could be addressed in the next test of change. So the plan in short is that during the next 2 weeks, all patients ages 65 and older who screened positive for fall risk using the clinic's fall risk screening tool during their appointment would be offered an assessment of their orthostatic blood pressure. So medical assistants and nurses were provided with in-person training and written instructions for how to measure orthostatic blood pressure for patients, and also how to educate patients about the purpose of measuring orthostatic blood pressure and what they could expect in the process. The clinic wants to trial out in this test of change if this process works well, if the assessment begins as soon as patients are roomed, since the assessment requires that patients start the process by lying down. The data that the clinic decided to collect was that in order to calculate rates of assessment of orthostatic blood pressure for eligible patients, they wanted to collect data from the medical records of all patients ages 65 and older who screened as at risk for falls during this 2-week trial time frame. They want to determine which of those patients do and do not have orthostatic blood pressure assessment results documented in the EMR. And the completion rate will be those who have fully completed their assessment of orthostatic blood pressure documented in the EMR, divided by the population of patients ages 65 and older who screened positive for fall risk. The medical assistants and the nursing staff also agreed to document their experiences and their observations of the current process for measuring orthostatic blood pressure, and that they would do so in a separate document. On this particular slide, we have a checklist that you can use for some key things to think about when you are developing the plan for your test of change. This includes things like making sure you have a clear objective for the test, that we're really clear about the specific change or changes that are going to be tested in this test cycle, the questions that you hope to answer in the test cycle, the predictions about what you think will happen. They should be related to the questions that you're hoping to answer. Clarifying the measures that you're going to collect in this specific test cycle, including clear numerators and denominators, so you have a clean operational definition for each measure. And then also being really clear about the design of the test. So what's the scale of this? Who's going to be involved? When and where is this going to happen? And then how are we going to analyze the data? And then also thinking about maybe some influential uncontrolled conditions that might ultimately influence the results of your test. These are things you can have staff monitor for, and to be able to document. You can use that information as you interpret your results. Next, we'll move on to the do phase. So we created our pretty robust plan for this test of change. Now in the do phase of the PDSA cycle, we do the work. So we're implementing the test that we planned. We're collecting the data that we proposed to collect in hopes that this will help us to answer the questions we generated in our plan phase. We can then compare that to the predictions that we made about what we think might happen during this particular test of change. So in the do phase, we run the test. We're collecting and monitoring data when we're documenting any successes, issues, problems, or unexpected observations along the way. So going back to our initial example of assessment of orthostatic blood pressure. In this particular example, the clinic initiates the plan. So for 2 weeks, they're going to run a trial to offer an assessment of orthostatic blood pressure to all of their patients ages 65 and older who screened positive for fall risk using the clinic's fall risk screening tool. About a week later, feedback was solicited from staff at their regular staff monthly staff meeting. What was learned is that staff were anecdotally reporting that the process to measure orthostatic blood pressure was taking a little bit longer than they initially expected. Sometimes they found it difficult to find another staff member to help with the assessment when needed. Some patients were questioning the staff about if they knew what they were doing because they're used to having their blood pressure measured only when sitting up. 2 patients refused the assessment. They didn't want to participate in it. And then 3 patients who had arrived for appointments came in with multiple issues to discuss during their clinic visit, and there just wasn't enough time to measure their orthostatic blood pressure. So staff were encouraged to continue to document their experiences and observations through the second week of this 2-week test. And then after the 2 weeks were complete, data was pulled from the medical record for analysis, and the experiences and observations documented by the staff were also compiled. So one key thing to keep in mind in the do phase, especially as we're collecting data, is that it's also helpful to collect data about any problems that might come up during the test of change or any unexpected things that happened, such as some of the feedback that was gathered from staff in that after the first week of the test of change. These types of observations are really helpful for learning, and they can help you to put your understanding and your analysis of the data that you're collecting into the context of what was going on and what was happening at the time you were running your test of change. A couple of key points to think about is when you're thinking about data collection during this phase, just making sure you're thinking about how you're collecting the data. Ideally, these things were already determined in the plan phase, but we can talk about them here as we're collecting and monitoring the data. So, are you collecting data on a form that already exists? Did you need to create something and then remind people to use it? Does the data exist in the EHR? Or are you able to easily pull it out of the electronic health record or medical record to gather the data? Making sure that the people who are collecting the data have clear and consistent instructions. And I think this is especially important when you're asking people like to actually document or help you collect the data. So if you're tracking, total time it takes to measure orthostatic blood pressure, or asking people to document or write down their experiences with the process. And then finally, again, just reiterating the importance of keeping track of things that are going particularly well, or perhaps problems that you're encountering that weren't expected, because that information can be really helpful to help us put our data into context and to better understand the results that we look at in the study phase. So that takes us to the study phase. So the study phase of the PDSA cycle, our test is done, and we're analyzing what we have learned from the do phase, so the phase in which we were running the test. So in the do phase, we were implementing the test that we planned. We were collecting the data that we were using to help us answer the questions that we generated in the plan phase. Now in the study phase, we're taking the data we collected and we're analyzing it so that we can compare, what the data tells us about that test of change with the predictions that we made earlier in our plan phase for the test of change. So this step of a PDSA cycle is kind of analogous to the idea of like conducting analysis and interpreting results if you were using some sort of scientific methodology. So let's go back to our example that we've been following about assessment of orthostatic blood pressure in a clinic. So in this particular example, during the study phase, the analysis revealed that the rate of assessment of orthostatic blood pressure increased from 0, which was the baseline, to 35%. Staff met again to talk briefly about the improvements that they observed, some successes and barriers, and to start to brainstorm some of their next steps. So some of the discussion about their test and their focus of starting the process for measuring orthostatic blood pressure as soon as the patients were roomed revealed the following items. So staff reported that it made sense to start the process as soon as the patients were roomed, given the amount of time it takes to complete the assessment of orthostatic blood pressure. Some staff felt concerned about leaving some patients alone while they were lying down in the exam room for 5 minutes because the exam tables in this particular clinic are rather narrow. And they were afraid that some patients might fall from the table. So those staff reported staying in the room for the 5-minute period to observe the patient and maintain their safety, but it also made it difficult for staff to complete other tasks that might have required them to be outside of the room. In some cases, a second staff member was needed to help safely assist a patient from the standing to lying position and vice versa, and to provide support during the measurement of orthostatic blood pressure. So the primary challenge reported with this was that it took time to both find and wait for another available staff member to support the assessment. And finally, in addition to reflections on the process, staff wanted to revise the patient education materials and process to help them better explain orthostatic blood pressure and the process to measure it to their patients. Finally, the last step of the PDSA approach is called ACT. So in the ACT phase of the PDSA cycle, we take what we've learned from our study of this particular type of change, and then we use that information to start to inform our direction and kind of our plan for the next step. So what is our next course of action? What's the next step that we're going to take? So based on what we've learned in the test of change, we have some decisions we can make about what we want to do moving forward. We might decide to adapt. So make adaptations, make modifications to something that we trialed out in this test of change. Maybe it's the change itself, maybe it's the way that you frame the problem, maybe it's the sample or the conditions under which you want to test the change, and then decide to run another test of change. We might decide to adopt. So things went great. We had no problems, and we decide to test the same change, but we want to do it on a larger scale. We also might decide to abandon. So we're not going to conduct another test on this change idea, and maybe we go back to the drawing board to think about what our next step might be. We then use that information to help inform and start to think about preparing for the next PDSA cycle. So if we go back to our example of assessment of orthostatic blood pressure, what this particular clinic did in this example, their adaptations moving forward. So they decided that given the length of time it takes to assess orthostatic blood pressure, the clinic decided to continue with starting the process as soon as patients were roomed. So that was something that they wanted to keep. To ensure patient safety, staff decided that they would trial remaining in the room for the entirety of the time in which patients must lie down. And during that time, staff would use that time to gather additional patient intake information that might be relevant to the patient's visit in order to try to streamline the appointment. And then finally, 2 staff members plan to revisit their patient education process and materials for assessing orthostatic blood pressure, and then intend to evaluate these in a future test cycle. So I think a really important component of the PDSA approach that I don't think is well promoted is just that it's not intended to be a one and done approach to improvement. So the purpose of the PDSA approach resides in running multiple tests of change to help us slowly and sequentially build knowledge about how a change is and isn't working in our own local context. So we use this method to help us learn kind of as quickly as possible, but as reasonably as possible, whether that change is going to work in a specific setting, and then make adjustments as we need to try to increase the chances that we're going to successfully implement and sustain whatever improvement it is that we're trying to make. So the lessons that we learned from one PDSI cycle really start to link together to inform the changes that we're going to test in the next cycles that follow. So with this in mind, we can really use the PDSA support approach to start to support the scaling up of changes and interventions from very small scale tests of change to wider scale tests of change, and then hopefully ultimately into something that you can implement and kind of routinize as the way that you do business. So in this particular slide, what we've done here is kind of laid out a couple examples of what it might look like to build upon an initial test of change that we just walked through in the example, how we might use that information then to inform the next test cycle and in future test cycles. We walked through the example on the slides where the clinic tested out their process for assessing orthostatic blood pressure. They decided to keep the process. What they're going to test in the next PDSA cycle is, what does it look like if staff stay in the room through the duration of the assessment of orthostatic blood pressure for patients, and then use that time to gather any additional patient intake information to try to streamline the appointment. So they have a plan. They ran the test for 2 weeks. They studied what happened. So they wanted to look at their actual rate of assessment of orthostatic blood pressure and compare that to where they landed at the end of the first test cycle. What maybe was learned in this particular example is that was working well, but patients seemed confused about the process of measuring orthostatic blood pressure and the time it takes to do so. So one of the action steps that came out of this particular test cycle was, again, to keep the process, and things were working well to try to streamline that process for staff. But that this issue of patient confusion about the process keeps coming up. So the next action step is to revise patient education materials and their process for delivering this education to patients. So we hope to see multiple test cycles where what you're learning from one test cycle informs what you do, kind of what you intend to change, whether it's keeping something or revising something and testing it out in future test cycles. Finally, this particular slide here just gives kind of some tips for you to think about in terms of, are you using the PDSA approach as it's really truly intended? So again, remembering that PDSA cycles aren't really intended to be in one and done situation, but rather it's intended to help you start with small tests of change that are then followed with a series of follow-up tests before we start making changes on a much larger scale. It's helpful to incorporate a variety of measures to help evaluate the changes that you are testing and their implementation. I think most important is just making sure that you're collecting data to help you answer the question that you're trying to answer with that particular test and change. Making sure you're capturing and also trying to address any implementation barriers. So the things that are working well, the things that staff are reporting are challenging, are important because oftentimes those might inform specific things that you might want to try to tweak or change or actually serve as the change as well to see if that has an effect on your outcomes. And that refinement over time is expected. So this is really a trial by learning approach for improvement. So in summary, together, the model for improvement and the use of the PDSA approach or PDSA cycles are really useful tools to help guide efforts to improve assessment of orthostatic blood pressure. If you can create a really clear and focused plan for a small test of change, that's an essential first step to help get you started. Make sure that you're really clear on the questions that you're trying to answer in each test cycle, because that will ultimately help to inform the data that you might need to collect in each test of change to tell you if your changes are working or not. And to remember that this is an iterative process to support change over time. So that you should expect to run several smaller tests of change using the PDSA approach. And through doing so, collecting data and really learning and observing what's working and what isn't, you can really utilize the PDSA approach as it's intended, and to ultimately kind of through an iterative process over time, be able to hopefully reach the broader aims and goals that you have for your improvement work. Finally, I will leave you with a link to a tool that you can download from the Institute for Healthcare Improvement to help support the development of PDSA cycles. This is a PDSA worksheet. In order to access these materials, you simply need to visit this link online, and then the Institute for Healthcare Improvement does ask for your name, your organization's name, and an email address in order to download the materials for free.